Welcome dear viewers. Today we will be discussing about the brainstem and the medulla in detail. Even before going into the medulla, we have a small intro about the brainstem. So the brainstem, as you know, it is made up of midbrain. This is the midbrain and pons, and then the lowermost one is the medulla. So all the vital centers which will control your respiration, which will control your cardiovascular activities, and those which will control your blood pressure are located in this brainstem. So this brainstem is very important because all the vital organs are being controlled by this brainstem, all the vital activities. So the one which we are generally referring to as the brain death is because of the damage to this brain stem. So if you all remember, all the cranial nerves will exit from this brain stem except the first and the second cranial nerve, that is except the optic and olfactory and optic. The remaining all cranial nerves, they will emerge out from the ventral aspect of the brain stem except the trochlear nerve. So trochlear nerve is the only cranial nerve which will emerge from the dorsal aspect of the brainstem. So in general, as a general rule, if you have to remember, the third and fourth cranial nerves will emerge from the midbrain, and 5, 6, 7 and 8 cranial nerves will emerge from the pons, and 9, 10, 11 and 12 cranial nerves will emerge from the medulla. So in today's class, we will be discussing in detail about the medulla. So when we talk about the medulla, we will be talking about the external features as well as the internal features. In this video, I will be talking about the external features of the medulla. So this is the medulla. Medulla, it will extend from the spinal cord at the level of foramen magnum, and it will extend up to the lower border of the pons. So it will extend from the upper part of the spinal cord at the level of foramen magnum and will extend up to the lower border of the pons. So medulla, it represents a truncated cone. So that is why it is also called as bulb. The other name for medulla is bulb. So medullary palsy is sometimes referred to as bulbar palsy as well. So that is because of its shape. So when we have to discuss about the external features of the medulla, we will be describing it under two views, that is ventral view and a dorsal view. So the one which is shown here is the ventral view, and the one which is being shown here is the dorsal view. So what are all the features we see in the ventral view of the medulla? So as I told you, it is a continuation of the spinal cord. So if you remember, in the spinal cord you will have a anteromedian fissure. So this continues above into the medulla as well. So this the ventral part of the medulla is being divided into two equal halves by the anteromedian fissure. Okay, and then lateral to that you have got anterolateral sulcus. Anterolateral sulcus. And even lateral to that you have got the posterolateral sulcus. So if you remember, in the spinal cord, actually in the anterior aspect you will be having the anteromedian fissure and the anterolateral sulcus. In the posterior aspect you will be seeing the posterolateral sulcus. But when you come to the medulla, you see the anteromedian fissure, anterolateral sulcus and posterolateral sulcus in the ventral view itself. So point to be noted. So the anteromedian fissure which is there will divide the ventral surface of the medulla into two equal halves. Now lateral to that you are having the anterolateral sulcus, and even lateral to that you are having the posterolateral sulcus. Now if you see carefully, in the upper half you are able to see one round and a oval elevation. This oval elevation. This is referred to as the olive. So the part of the medulla which is present between the anteromedian fissure and the olive, this part is referred to as the pyramid. So why this is called as pyramid is, this is formed by the cortico-spinal tract or the pyramidal tract. This elevation is formed by the underlying pyramidal tract. So this is called as the pyramid. And this olive which is there, this oval swelling which is there in between the anterolateral fissure and between the posterolateral fissure is overlying the olivary nucleus. So that is why it is given the name olive. So if you see carefully from medial to lateral side, you have got the anteromedian fissure, then you have got the pyramid, then you have got the anterolateral sulcus, then you have got the olive, then posterolateral sulcus, and even lateral to the posterolateral sulcus, this part is the bundle of nerve fibers which will connect medulla with the cerebellum. So that is called as the inferior cerebellar peduncle. So now if you have a careful look at this, the anteromedian fissure which is there, it is ending in a triangular depression at the lower border of the pons. So this triangular depression, it is referred to as foramen cecum. And lower down, if you are tracing this anteromedian fissure, it is becoming discontinuous. That is discontinuous. Why? Because there is crossing over of the lateral cortico-spinal tract. You know, 75% of the fibers of the cortico-spinal tract will cross over. So because of that crossing over, this anteromedian fissure is disturbed in its lower half. So this is about the ventral view of the medulla. So now let us have a look at the dorsal view of the medulla. This is the dorsal view of the medulla. So the central canal of the spinal cord will continue in the medulla for a certain extent and then it will open up. Thus you will have a closed part of the medulla and you will have a open part of the medulla. So this is the lower closed part of the medulla and upper open part of the medulla. So this upper open part of the medulla, it will form the floor of the fourth ventricle. So it will form a part of the floor of the fourth ventricle. So the features which you see in the floor of the fourth ventricle, I will be discussing it in detail in my video of the floor of the fourth ventricle. But as of now, please remember these points which you see here. So this is the median sulcus in the center, and then lateral to that you have got the sulcus limitans. So this sulcus limitans, it will join the median sulcus, thus dividing this medial eminence into two triangular halves. So the upper triangle is called as the hypoglossal triangle and the lower triangle is called as the vagal triangle. And lateral to that you see this is the vestibular area. And just below the vagal triangle you will be seeing an area which is called as area postrema. So all these form the part of the floor of the fourth ventricle. So this you can see it in the video of the floor of fourth ventricle. But as of now, the features you see in the upper open part of the medulla are, you see a median sulcus, then you see a sulcus limitans which is present lateral to that, and it will divide the medial eminence into two triangular. So upper hypoglossal triangle and a lower vagal triangle. So just below the vagal triangle you see one more area which is called as area postrema, and lateral most you will be seeing the vestibular area. So these are the features which you see in the upper open part of the medulla. Now coming to the lower closed part of the medulla. So this is the lower closed part of the medulla, and if you see carefully, in the center you are having the posteromedian sulcus. Posteromedian sulcus, which will divide the dorsal part of the medulla into two equal halves. Now just lateral to the posteromedian sulcus, you see one elevation. This is called as gracile tubercle. And lateral to this gracile tubercle, you see one more elevation which is referred to as the cuneate tubercle. So these from the center, if you see, you have got the posteromedian sulcus, lateral to that you have got the gracile tubercle, and lateral to that you have got the cuneate tubercle, and even more lateral to that you have got one more elevation which is called as tuber cinereum. Now how are these elevations formed? This gracile tubercle which is there, it will overlie the nucleus gracilis, and this cuneate tubercle, it will overlie the nucleus cuneatus, and the tuber cinereum which is present in the lateral most part is overlie the spinal nucleus of the trigeminal nerve and its tract. So the features you see in the dorsal part of the medulla is, you see the posteromedian sulcus which will divide the posterior part of the medulla into two equal halves, and then lateral to that you see the gracile tubercle which overlies the nucleus gracilis. Lateral to that you see the cuneate tubercle which will overlie the nucleus cuneatus, and even more lateral to that you see one more elevation which is called as tuber cinereum which will overlie the spinal nucleus of the trigeminal nerve and its tract. So these are the features you see in the lower closed part of the medulla. So this gracile tubercle will continue below as the fasciculus gracilis, and cuneate tubercle will continue below as the fasciculus cuneatus. So the cranial nerves in relation to medulla, as I told you, the 9, 10, 11 and 12 cranial nerves are related to the medulla. That is, they will emerge from the ventral aspect of the medulla. So from where do they emerge? 9, 10 and 11 cranial nerves. 9, 10 and 11. So that is vagus, glossopharyngeal and cranial part of accessory. So these will emerge from the junction between the olive and the inferior cerebellar peduncle. So that is, they will emerge from the posterolateral sulcus. So this is the posterolateral sulcus. So you see, this is the 9th cranial nerve, this is the 10th cranial nerve, and this is the 11th cranial nerve. 11th cranial nerve, as you all know, accessory nerve, it has got two components. It will have a cranial component and a spinal component. The cranial component will emerge from this posterolateral sulcus, and the spinal component will ascend upwards, and both of them together will join to form the accessory nerve. So this is the spinal component of the accessory nerve, and this is the cranial component of the accessory nerve. So the cranial component is emerging out from the medulla. Next, the 12th cranial nerve, that is the hypoglossal nerve. So the hypoglossal nerve will emerge from the ventral surface of the medulla from the junction between the pyramid and the olive, that is from the anterolateral sulcus. So this is the anterolateral sulcus. It will emerge in the form of 10 to 12 rootlets which will unite to form the hypoglossal nerve. So these are the nerves in relation to the medulla. Now that we have completed the external features and we have seen all the cranial nerves which are related to the medulla, now moving on, we will have a look at the internal structure of the medulla. So if you want to look at the internal structure of the medulla, we will take cut sections at 3 different levels, because you know medulla, it's not the same throughout. It is having a closed part, it is having an open part, and different nuclei are present at different levels. So in order to discuss the internal structure, we will take sections at 3 different levels. So the first level is at the level of pyramidal decussation. I told you there is crossing over of the cortico-spinal tract fibers at this level. So we are taking one section at the level of pyramidal decussation. And then we will take one more section at the level of the sensory decussation, at the lower limit of the olives. So one more section at the level of sensory decussation. And we will take one more section at the level of olives. So at the level of olivary nucleus. At the level of olives. So we are taking three transverse sections of the medulla. One is at the level of pyramidal decussation, that is at the lower level, and in the middle we are taking one section at the level of the sensory decussation, and in the upper level we are taking a section at the level of the olives. Now let us discuss in detail what are all the features present in each level. So now let us have a look at the section of the medulla at the level of the pyramidal decussation, that is at the lower level of the medulla. So we are taking a transverse section at the lower level of the medulla. So what are all the features? So this is how the TS of the medulla will look at the level of pyramidal decussation. So as you all know, just like the spinal cord, the medulla also will have the central grey matter surrounded by the peripheral white matter. So you can see this is the central canal, just similar to the spinal section of the spinal cord. So this is the anterior horn, and there are few modifications in the posterior horn of the grey matter. So when you take a section of the medulla at the level of the pyramidal decussation, the posterior part of the grey matter, you see it is being elongated to form two horns. These are called as nucleus gracilis, and this is called as nucleus cuneatus. So this is the ventral aspect and this is the dorsal aspect. So you relate this here. This is the dorsal aspect of the medulla. We have seen the gracile tubercle and we have seen the cuneate tubercle. So the medial most is gracile, and later to that we have seen the cuneate tubercle, and later to that we have seen one more elevation which is called as tuber cinereum. So this gracile tubercle is overlying this nucleus gracilis, and this cuneate tubercle is overlying this nucleus cuneatus, and this tuber cinereum will overlie this part. So if you look carefully, the posterior horn of the medulla, it is modifying to form the spinal nucleus of the trigeminal nerve, and it is being capped by one structure which is the spinal tract of the trigeminal nerve. Now this spinal nucleus and spinal tract will produce a elevation in the exterior, which we were referring to as the tuber cinereum in the dorsal view of the medulla. So this is the posterior part of the grey matter. Now we will have a look at the white matter. What is present in the white matter? So as you all know, within the white matter we will have fibers, and within the grey matter we will have nuclei. So what is present in the white matter of the medulla? So you can see two tracts which are being seen over here. So these are referred to as the spinocerebellar tracts, so which extends from the spinal cord to the cerebellum. So this is the dorsal spinocerebellar tract, and this is the ventral spinocerebellar tract. And then medial to that you see one more tract which is present. This is called as the lateral spinothalamic tract. So this lateral spinothalamic tract is the one which carries the pain and temperature sensations from the trunk and the limbs. So we see the dorsal spinocerebellar tract, we are seeing the ventral spinocerebellar tract, and we are seeing the lateral spinothalamic tract in the lateral part of the white matter. In the posterior part of the white matter, we see capping this nucleus gracilis. This is the funiculus gracilis. And this is called as funiculus cuneatus. So we've seen continuation of the gracile tubercle as fasciculus gracilis and continuation of the cuneate tubercle as fasciculus cuneatus. So these form the fasciculus gracilis and fasciculus cuneatus, which will form the posterior columns, which are responsible for the position and vibration sense. So in the white matter, so these are the fibers which we see. And then now if you have a look at the anterior aspect, so this is the anterior aspect or the ventral view of the medulla. So in the ventral view we have seen just lateral to the anteromedian fissure. So this is the anteromedian fissure. So just lateral to that we have seen two elevations which we have called them as pyramids. So here we have got the pyramids. So this is the place for the pyramids. Okay. So what happens? The corticospinal tract which is there, the fibers, they will pass backwards and they will cross over. There is, you can see there is crossing over of the fibers. So because of this crossing over, we have seen here that the anteromedian fissure is being disturbed. It is now becoming discontinuous. So there is a crossing over of 75 to 80% of the fibers of the corticospinal tract. So they pass backwards and they cross over each other and they form the lateral corticospinal tract. So this is the lateral corticospinal tract. So this lateral corticospinal tract, you can see it in the sections of the spinal cord later on after this. So the crossing over of the fibers corticospinal tract, it will take place at this level. So that is why we are describing this section as TS at the level of the pyramidal decussation. So that is the major event which is occurring at this level. So because of this crossing over, the lateral corticospinal tract is formed. Next, because of this crossing over and passage of these corticospinal tract fibers, you see the anterior horn, which is the anterior horn of the grey matter, is being cut off. So it is being cut off. So this anterior horn of the grey matter which is being cut off, it will form the spinal nucleus of the accessory nerve. And it will form the supraspinal nucleus of the first cervical nerve. Okay, so it is forming the spinal nucleus of the accessory nerve, which will descend up to the fifth spinal segment, and then it is forming the supraspinal nucleus of the first cervical nerve. So these are all the features which you see in relation to the transverse section of the medulla at the level of pyramidal decussation. So if you remember the external features and if you correlate it with the internal structure, it is very easy for you to remember. So I am just giving a synopsis of the whole thing. So this is the central grey matter surrounded by the white matter. In the central grey matter, the posterior part of the grey matter is elongating to form two columns which will form the nucleus gracilis and nucleus cuneatus, and the posterior horn is forming the spinal nucleus of the trigeminal nerve, which is capped by the spinal tract of the trigeminal nerve. And then the anterior horn of the grey matter, after being detached because of the crossing over of the pyramidal fibers, it will form the spinal nucleus of the accessory nerve and supraspinal nucleus of the first cervical nerve. So these are what you see in the grey matter. Now what about the white matter? As I told you, within the white matter we will see the nerve fibers. So in the white matter, you see the fasciculus gracilis overlying the nucleus gracilis and fasciculus cuneatus, and then you see dorsal spinocerebellar tract and ventral spinocerebellar tract, and you see the lateral spinothalamic tract. And the major event which is happening here is the crossing over of the cortico-spinal tract fibers, which will form the lateral cortico-spinal tract. So remember, not all the fibers of the cortico-spinal tract will cross over. Only 75 to 80% will cross over and they will form the lateral cortico-spinal tract. Remaining 20% they will continue on the same side and they will continue as the anterior cortico-spinal tract. So this is in detail about the section of the medulla at the level of the pyramidal decussation. So in this video we will be discussing about the internal structure of the medulla at the level of the sensory decussation. So we are taking a section in the middle of the medulla just below the olive. So these are the features which are seen when we take a section at the level of the sensory decussation. So if you see carefully, the grey matter which is there is diminished in size and the majority is occupied by the white matter. So what are all the features which we see in tiers of the medulla at the level of sensory decussation? So the most conspicuous feature which is seen is the formation of the medial lemniscus. So this is the medial lemniscus. So this is the important change which is occurring in the section at this level. Section of the medulla at the level of sensory decussation is the formation of the medial lemniscus. So we will go into the detail. Now if you see the nucleus gracilis and nucleus cuneatus, they are detaching from the central grey matter and they are becoming more pronounced in this level. So this is the nucleus gracilis and this is the nucleus cuneatus. So in the previous section at the level of the pyramidal decussation, these were connected to the central grey matter. Now these nuclei, they are detaching from the central grey matter and they are becoming more prominent. So medial most, you have got the nucleus gracilis in the posterior funiculus and nucleus cuneatus just lateral to that. And then lateral to that is ventrolateral to this nucleus cuneatus, you have got the spinal nucleus of the trigeminal nerve and this is the spinal tract of the trigeminal nerve. Okay. So if you see carefully, I told you the important feature seen in this level at the level of sensory decussation is the formation of the medial lemniscus. So how is this medial lemniscus formed? So this nucleus gracilis and nucleus cuneatus which is there, so these form the second order neurons for the sensations of the position sense, vibration sense and discriminative touch. So for the posterior columns, so the posterior columns, they will carry these sensations. So these will form the second order neurons. So second order neurons where there will be a relay. So the fibers from the nucleus gracilis and nucleus cuneatus, they pass lateral to the central grey matter and there is crossing over of these fibers is occurring and thus there is a formation of the medial lemniscus. These fibers, they are referred to as internal arcuate fibers. Internal arcuate fibers. So we will see how this medial lemniscus is formed. So the nucleus gracilis which act as a second order neuron and the fibers from here which carry the position, vibration and discriminative touch from the lower limbs, they will pass anteriorly, passing just lateral to the central grey matter and they are reaching the opposite side. They are crossing to the opposite side and they come to lie in the anterior part of the medial lemniscus. So the lower limb fibers, they are passing lateral to the central grey matter, but they are present medial to the fibers of from the nucleus cuneatus. So they pass medial to these fibers and they cross over and they are reaching the anterior part of the medial lemniscus. So the lower limb is being represented anteriorly in the medial lemniscus. So here is the lower limb representation. Next, the fibers from the nucleus cuneatus. So these fibers, they carry the sensations from the upper limb. So these fibers, they pass laterally to the fibers of the nucleus gracilis and then they cross over to the opposite side and they come to lie in the posterior aspect of the medial lemniscus. So now you should understand, in the medial lemniscus, from anterior to posterior, anteriorly lower limb is being represented and posteriorly the upper limb is being represented. So that is a reversal in the representation. Lower limb is represented anteriorly and upper limb is being represented posteriorly. So that is because of the crossing over of these fibers. These fibers, they are referred to as the internal arcuate fibers. So this crossing over is what we are referring to as the sensory decussation. So this is the important feature which is occurring at this level. So after they cross over, they will ascend upwards into and they will relay finally in the corresponding thalamus. So while ascending, they will form this medial lemniscus. So that is how the important part, the medial lemniscus, is being formed. And by the crossing over of these fibers, you see this spinal nucleus of the trigeminal nerve is being cut off from the central grey matter. It is being cut off from the central grey matter and this comes to lie ventral and lateral to this nucleus cuneatus and nucleus gracilis. And then if you see in the lateral part of the white matter, we see the dorsal spinocerebellar tract and the ventral spinocerebellar tract, and we see the lateral spinothalamic tract. So in this level, actually the lateral spinothalamic tract and the anterior spinothalamic tract, they will lie close to each other and they form the spinal lemniscus. Okay, so the lateral spinothalamic tract and the anterior spinothalamic tract, they will form the spinal lemniscus. So in the anterior part, you see these are the pyramids. So this is occupied by the pyramidal tract. So this is the pyramids. And then dorsal to this pyramid, if you see, there is beginning of the inferior olivary nucleus. So we are taking a section at this level, just at the lower level of the olives. So that is why there is beginning of the inferior olivary nucleus. I told you previously, olive is overlying the inferior olivary nucleus. The so-called olive is formed by the underlying inferior olivary nucleus. Okay, so we see the beginning of the inferior olivary nucleus, and this is the reticular formation of the. And now, if you have a look at the grey matter, it is very much diminished in size, and you see the presence of the 3 nuclei. So this first one, which is present anteriorly or ventrally, is the hypoglossal nerve nucleus. Hypoglossal nucleus. And then which the nucleus which is present dorsolaterally to this hypoglossal nucleus is called as dorsal nucleus of vagus. And dorsolateral to this dorsal nucleus of vagus, you have got the nucleus tractus solitarius. So this nucleus tractus solitarius will carry the taste sensation. Okay. So we know when we are taking a section at this level, we have seen 9, 10, 11 cranial nerves are taking origin and this 12th cranial nerve is taking origin. So the nuclei which correspond to these nerves, they are present in the central grey matter. So anteriorly you have got the hypoglossal nerve nucleus, dorsolateral to that you have got the dorsal nucleus of the vagus, dorsolateral to this dorsal nucleus of vagus you have got the nucleus tractus solitarius. And the gap between this central grey matter and this medial lemniscus is occupied by a bundle of white fibers which are called as medial longitudinal fasciculus. So this medial longitudinal fasciculus is nothing but a compact bundle of nerve fibers which will connect the 3, 4, 6, 8 and spinal part of the 11th cranial nerve. That is the spinal part of the accessory nerve. So these are all the features which you see in the transverse section of medulla at the level of sensory decussation. So let's repeat once. So the nucleus gracilis and nucleus cuneatus, they are becoming more prominent, and the internal arcuate fibers, they are crossing over to the opposite side, forming the medial lemniscus. In the medial lemniscus, the lower limb is being represented anteriorly and the upper limb is being represented posteriorly, and then because of this crossing over, the spinal nucleus of the trigeminal nerve is being cut off from the central grey matter, and you see the beginning of the inferior olivary nucleus, and in the anterior part of the white matter you see the pyramids, and in the lateral white matter you see the dorsal spinocerebellar tract and ventral spinocerebellar tract and the lateral spinothalamic tract, and this is the reticular formation. Coming to the central grey matter, you see the hypoglossal nerve nucleus, dorsal nucleus of vagus and nucleus tractus solitarius, and the gap between the medial lemniscus and the central grey matter is being occupied by a medial longitudinal fasciculus. So this is in detail about the transverse section of the medulla at the level of sensory decussations. So we will take a section in the upper part of the medulla which will pass through the floor of the fourth ventricle and it will pass through the middle of the olives. So we will take a section in the middle of the olives. So what are all the features we see in the transverse section of the medulla at the level of olives? So if you see carefully, this is the floor of the fourth ventricle. So it is the open part of the medulla. So the central grey matter, the nuclei which were present in the central grey matter, they are being spread laterally along the floor of the, this is the floor of the fourth ventricle. So they are being spread along the floor of the fourth ventricle. So medial most in the posterior aspect we have got the hypoglossal nerve nucleus. Hypoglossal nucleus and nucleus intercalatus which is present lateral to that, and then lateral to that you have got the dorsal nucleus of vagus, and just ventral to this you have got the nucleus tractus solitarius. And lateral most you have got the vestibular nucleus. So from medial to lateral you have got the hypoglossal nucleus, then we have got the nucleus intercalatus, then you have got the dorsal nucleus of vagus and nucleus tractus solitarius and the vestibular nucleus from medial to lateral. So because the part of the medulla is being opened, it is forming the open part of the medulla which forms the floor of the fourth ventricle. The nuclei which were present in the central grey matter, they are being distributed along the floor of the fourth ventricle. They are spreading laterally. So in this section, the we are taking the section at the level of olive. So the important feature which you see here is the inferior olivary nucleus. So this is the inferior olivary nucleus. So this inferior olivary nucleus, it gives the appearance of a crumbled bag. So it gives the appearance of a crumbled bag. So if you see, there are two accessory olivary nucleus which are accompanying this inferior olivary nucleus. So this is called as dorsal accessory olivary nucleus, and this is called as medial accessory olivary nucleus. Okay. So this is the dorsal accessory olivary nucleus, and this is the medial accessory olivary nucleus, and this is the inferior olivary nucleus. So we call it as the olivary nuclear complex. So this is the important feature which we see at the level of the olives. So coming to the paramedian position. So this is the paramedian position on either side of the midline. We see these nerve fiber bundles. So the first one which we see is the medial longitudinal fasciculus. So posterior most we have got the medial longitudinal fasciculus. So ventral to that you have got the tectospinal tract. And more ventrally we have got the medial lemniscus. So in the paramedian position, we have got the medial longitudinal fasciculus, we have got the tectospinal tract and the medial lemniscus. So in an order from dorsal to ventral aspect or from posterior to anteriorly, these are the structures which are present in the paramedian part of the medulla. And then if you see just lateral to that, you can see the presence of one nucleus which is called as nucleus ambiguus. Nucleus ambiguus. So this nucleus ambiguus which is there, it will give, it is present deep to the reticular formation, deep within the reticular formation, and it will give origin to the motor fibers of the 9, 10 and 11 cranial nerves. So in this section, you see the emerging of two nerves. We see the emerging of the hypoglossal nerve and we see the emerging of the vagus nerve. So the vagus nerve, it takes its origin from all these nuclei. It takes the motor fibers will arise from the nucleus ambiguus, and then you have got fibers arising from the dorsal nucleus of the vagus, and you have got fibers arising from the nucleus tractus solitarius. So all these fibers will unite to form the vagus nerve. So this will emerge ventrally from the medulla. And the fibers from the hypoglossal nerve nucleus will emerge ventrally on just lateral to the pyramid from the ventral aspect of the medulla as the hypoglossal nerve. So we see the emerging of the two nerves, hypoglossal nerve and the vagus nerve. So and apart from this, we see the here we see the spinocerebellar tracts and you see the spinothalamic tract. So this is the dorsal and ventral spinocerebellar tracts, and you see the lateral spinothalamic tract. So important feature which we see here is the olivary nuclear complex, and then anteriorly and posteriorly you see two important conspicuous structures. So this is the pyramid. So this is related anteromedially to the arcuate nucleus. Arcuate nucleus. So this is the arcuate nucleus which is present anteromedial to the pyramid, and posteriorly the important structure which you are being able to see is the inferior cerebellar peduncle. So this is the one which consists of the nerve fibers which will connect the medulla with the cerebellum. So as a whole, if we see, just to summarize, we see the nuclei which are present in the central gray matter are being scattered laterally along the floor of the fourth ventricle. So medially in the posterior aspect you are seeing the hypoglossal nerve nucleus, dorsal nucleus of vagus, nucleus tractus solitarius and vestibular nucleus. And then here you see the spinal nucleus of the trigeminal nerve with its tract. And ventral you see this is the nucleus ambiguous, and in the paramedian position you are able to see the median longitudinal fasciculus, tectospinal tract and the medial lemniscus. And you can see emergence of two cranial nerves, that is hypoglossal nerve and the vagus nerve. You can see the olivary nuclear complex that is found by the inferior olivary nucleus and its two accessory olivary nuclei. And anteriorly you have got the pyramid which is occupied by the pyramidal tract, and anteromedial to the pyramid you have got the arcuate nucleus, and in the posterior aspect, that is dorsolaterally, we have got the inferior cerebellar peduncle. So this is in total about the transverse section of the medulla at the level of olives. In this video, let us discuss about the various applied aspects in relation to medulla. So there are two syndromes which are related to medulla. One is lateral medullary syndrome and medial medullary syndrome. So the dorsolateral part, this is the dorsolateral part of the medulla. It is being supplied by the pica. This is posterior inferior cerebellar artery. It is generally remembered as pica, posterior inferior cerebellar artery. So this is a branch of the vertebral artery. It is generally a branch of the vertebral artery. So this supplies the dorsolateral part of the medulla. So when this artery is being blocked, so there will be a lateral medullary syndrome. This lateral medullary syndrome is otherwise called as Wallenberg syndrome. So this is a very frequently asked question in your exams. So try to memorize all these. So it is also called as Wallenberg syndrome. So what are all the features which we see in this lateral medullary syndrome? So as I told you, this dorsolateral part of the medulla which is being supplied by the posterior inferior cerebellar artery is being affected in this lateral medullary syndrome. So what is happening? So because there is involvement of the lateral spinothalamic tract. So this is the lateral spinothalamic tract. So lateral spinothalamic tract is being involved. So there will be a loss of pain and temperature sensation in the opposite half of the body. Opposite half of the body, that is the trunk and the limbs. So there is a loss of pain and temperature sensation in the opposite half of the body because of the involvement of the lateral spinothalamic tract. Then there is involvement of the spinal tract of the trigeminal nerve. Spinal tract of the trigeminal nerve. So because of the involvement of the spinal tract of the trigeminal nerve, there is loss of pain and temperature sense in the same half of the face. So opposite we refer to it as contralateral, and on the same side we call it as ipsilateral. Same side, ipsilateral. Okay. So because of the involvement of the spinal tract, there is ipsilateral loss of pain and temperature sensation on the same side of the face. Next, what are the other nuclei which are involved? So you see, this is the nucleus ambiguous. The nucleus ambiguous is being involved. So I told you in my previous lecture that this nucleus ambiguous will give rise to motor fibers of the 9, 10 and 11 cranial nerves. So because the nucleus ambiguous is being involved, there will be a ipsilateral paralysis, that is same side paralysis of the muscles of the palate, pharynx and larynx. because the motor fibers for the 9 and 10 cranial nerves, they are coming from this. So because the nucleus ambiguous is involved, same side paralysis of the muscles of the palate, pharynx and larynx will be there. And next you see the vestibular nucleus is involved. So because the vestibular nucleus is involved, the patient will have giddiness. And next you see, this is the inferior cerebellar peduncle. So inferior cerebellar peduncle is being involved. So the patient will have ataxia. What is ataxia? So if you ask a patient to close their eyes and walk in a straight line, they won't be able to walk in a straight line. So that thing is called as ataxia. In normal individuals, if we can close our eyes, we can still walk in a straight line. But patients who have got this damage to this inferior cerebellar peduncle or cerebellum, they will have this ataxia. Next, due to the involvement of the sympathetic pathway, there can be Horner's syndrome. So, as a whole, in the lateral medullary syndrome, because of the involvement of the lateral spinothalamic tract, there is contralateral loss of pain and temperature of the trunk and limbs. Next, due to the involvement of the spinal tract of the trigeminal nerve, there is ipsilateral loss of pain and temperature sensation of the face. And then due to the involvement of the nucleus ambiguous, there is ipsilateral paralysis of the muscles of the palate, pharynx and larynx. Because of the involvement of the vestibular nucleus, patient will have giddiness, and due to the involvement of the inferior cerebellar peduncle, patient will have ataxia, and due to the involvement of the sympathetic pathway, they will have the Horner's syndrome. So these are all the features you see in the lateral medullary syndrome. Now we will discuss about the medial medullary syndrome. So the medialmost part or the paramedian part of the medulla is being supplied by the branches of the vertebral artery. So if there is any ischemia to this paramedian region, so this is the paramedian region. Okay. So if there is any ischemia which hampers the blood supply to this region, so that will give rise to this medial medullary syndrome. So what are all the structures which are involved here? So first is the pyramid. So the pyramidal tract is being involved. So because of the involvement of the pyramidal tract or the corticospinal tract, so there is contralateral hemiplegia. So paralysis of the opposite half of the body. There will be a contralateral hemiplegia due to involvement of the pyramid. Next, due to involvement of the hypoglossal nucleus. There is involvement of the hypoglossal nucleus. So there will be a paralysis of the muscles of the tongue. Of the same side. So you know the hypoglossal nerve will be supplying to the muscles of the tongue of the same side. Because this is involved, there will be paralysis of the muscles of the tongue on the same side. That is ipsilateral paralysis of the muscles of the tongue. And then this medial lemniscus is involved. Because of the involvement of the medial lemniscus, so there will be a loss of position and vibration sense in the contralateral part of the body, opposite side. Loss of position and vibration sense because of the damage to this medial lemniscus. So, as a whole, in the medial medullary syndrome, due to involvement of the pyramidal tract, you have got contralateral hemiplegia of the upper and lower limbs, and then due to the involvement of the hypoglossal nerve nucleus, there is ipsilateral paralysis of the muscles of the tongue, and due to the involvement of the medial lemniscus, there is contralateral loss of position and vibration sense in the opposite half of the body. So this is about the medial medullary syndrome.